Acid-base balance. It's all about blood, lungs, and kidneys. So your normal value for blood is your pH, 7.35 to 7.45. And then you have your carbon dioxide, which is your CO2, and that's 35 to 45. And then you have oxygen also, which is 80 to 100, and that represents the amount of oxygen dissolved in the plasma. And then you have your HCl3, which is your bicarbonate, and that's 22 to 26, and that is going to measure the metabolic component. So you have blood, you have respiratory, and you have metabolic. So if you remember Rome, which is respiratory opposite, metabolic equal, that's going to tell us how we can tell if the patient is respiratory acidosis or alkalosis or metabolic acidosis and alkalosis. So for respiratory acidosis, that person will be hypoventilating. So hypoventilating is really slow breathing. So you're breathing in a lot of oxygen. So you're not letting out the carbon dioxide. And we know that with this, the pH is low because it's acidosis. It's under 7.35. So in order for your body to compensate for that, the kidneys are going to raise the pH so that you get back to this balance right here in the middle. So for respiratory alkalosis, we know it's alkalosis because the pH is high and the CO2 is going to be down. So with hyperventilation, you're breathing really fast, really fast. You can't get in, you can't get out enough CO2 because you're breathing it in so fast, it's not coming out. So in order to compensate that, your kidneys are going to release its bicarbonate to lower the pH. With metabolic acidosis, now you're going to see the lungs perform. So the metabolic acidosis patient is going to be hyperventilating because their pH is low, which we know it's under 7.35, and their bicarbonate is low. So in order to compensate, now your lungs are going to go to work and they're going to blow off their carbon dioxide in order to raise that pH, to get it back to homeostasis, back to balance. And then with metabolic alkalosis, they're hypoventilating because the lungs are trying to retain the carbon dioxide in order to lower that pH because it's high. So if you remember Rome, respiratory opposite the arrows, metabolic equal, respiratory acidosis, you're hypoventilating, respiratory alkalosis, you are hyperventilating. And then these two right here, they're going to switch when it comes to metabolic. So you're going to hyperventilate with acidosis and hypoventilate with alkalosis.